All right, good afternoon and welcome to today's webinar. Thank you very, very much for being here today. I hope that this is going to be an exciting and insightful session for you. If you don't know me yet or I haven't met you, my name is Stephanie and I'm from the company Learning Curve, and I'm one of the anatomists on staff who assist with the use of Primal Pictures in teaching and learning. And today this is a staff-focused webinar, and we are going to be focusing on the education of the clinical anatomy of the head and neck. Now, I'm sure I'm preaching to the converted over here, but the anatomy of the head and neck can be incredibly complicated, and it's very important to make this anatomy more relatable and memorable for the students. There is a huge number of anatomical structures in this region of the body, and this anatomy is very important. Sorry, I'm just going to request that you all keep yourselves muted just so this can run smoothly. And then at the end of the session, I will open up the floor for questions and answers. So if you wouldn't mind keeping yourselves muted, I'd really appreciate that. But as I was saying, the structures here can be incredibly complicated and there's a huge number of them. So when teaching on the anatomy of the head and neck, it's very important to be able to convey the content using concise and accurate as well as clinically relevant explanations. And that's exactly what we're going to explore today. So a bit of an agenda of the workflow is I will briefly remind you all how to access Primal Pictures. If you are sitting in the webinar today, you are most likely from one of our client institutions and you should have access to Primal Pictures. And then we will explore 3 titles today. We will explore the head and neck or neuroanatomy, which is one of the clinical specialties. We will also explore otolaryngology, another clinical specialty, and then we will finish off in diseases and conditions, which gives us some examples of common diseases and conditions and explains how they progress within the body. Okay, so just to remind you all firstly how to access Primal Pictures. It is a web-based application and most of our clients are set up with IP authentication. So if you are on campus and connected to the university Wi-Fi, if you go directly to the website, which is anatomy.tv, then you should be logged straight in. Now, if you are off campus or not connected to the university Wi-Fi, you are going to need to go through your library database web page. So your institution will have a e-resources or e-database list on your library website, and there you will find anatomy.tv or Primal Pictures listed. A few of our clients do use username and password to access Primal Pictures, but if that is your case, I'm sure you will be aware of it. But if worse comes to worse, if you're having any issues with accessing, I would recommend chatting to your librarians, or you can also reach out to us via email and we'll be able to help you out. Okay, the first 2 titles that we will explore today are head and neck and otolaryngology. And as I mentioned, these are 2 of the clinical specialty titles. Within these titles, we will be able to explore the gross, clinical, and surgical anatomy of the head and neck. And we will see really amazing ways to engage your students in your teaching material using 3D models, animations, movies, slides, dissection content, all of that wonderful stuff. And the strategies that we'll take a look at will also help you increase your students' spatial awareness and structural recognition using a few different things. But one of the large things that we'll focus on there is medical imaging and MRI slides. Then once we're finished with the 2 clinical specialties, we will jump over into the disease and conditions title. This is where we will get concrete examples that will allow the students to translate their theoretical knowledge into the clinical setting. And this is really going to help students evaluate the relevant anatomical consequences, symptoms, diagnosis, and treatment of just under 100 common diseases and conditions. Okay, but without further ado, let's jump into the platform. While I just change what screen I'm sharing over here, I do want to mention that if you don't have access to any of the titles that we take a look at today or any of the content that we explore, and you would like to take a look at it, please reach out to us and we will happily open up a 30-day access for free and you can give it a bit of a whirl. Okay, but here I am on the homepage of Primal Pictures. Where we're going to spend our time today is in the clinical specialties, and we will start off in the head and neck, basic neuroanatomy, and the otolaryngology titles. And then, as I mentioned, we will jump over into diseases and conditions. If you do have any questions as we go along, please just note them down or remember them. And then, as I said at the end of the session, I will open up the floor for a Q&A session. But if you're scared that you'll lose your question, you're welcome to pop it in the chat box in the meantime, and I'll address it at the end. Okay, but here I am in the head and neck or basic neuroanatomy title. In case you haven't seen this title before, I'm just going to start off with orientating ourselves, as us anatomists love to do. But on the left-hand side over here, you have your menu bar. In the middle, you have your main viewing pane or your interaction pane, and this is where all of your wonderful three-dimensional content is going to be projected. And on the right-hand side, you have your information pane. Now, this title is going to focus on the anatomy of the head and neck with focus on neuroanatomy. And I am going to spend this session over here focusing on the neuroanatomy within this title. The first icon that we have are the 3D views or 3D models that we have available to us. And these have been categorized into different groups. And I'm naturally going to come down to the brain to enable us to focus on neuroanatomy. And I'm going to start off with this 3D model that covers the meninges. The purpose of this is just to show you how to use the 3D models. Now, my brain's upside down currently, so I'm going to rotate it a bit. You can rotate your models either by using the left and right arrows, or you can simply click on your screen and swipe along it, and you'll see that the model then rotates. Now, as I roll my mouse over structures, you'll see I'm getting the name of a structure. And if you select a structure, it will be highlighted and you will get all of the relevant explanatory information about that structure in your information pane. So that will change as you change what structure you have selected. I can then move between different layers of anatomy using the up and down arrows. So if I click this up arrow, I've now added the pia mater onto this model. If I move up again, we have the arachnoid mater, and then one more level, we have the meningeal layer of the dura mater, and then we will add in some of our sinuses, followed by the periosteal layer of the dura mater. Now, the reason why I chose this model is because I really love this specific view. Now, when we move between the layers over here, it's going to really help us understand the positioning of those different meninges. So here I can see my cerebrum, my pia mater, arachnoid, the meningeal layer of the dura mater, and then that periosteal layer, as well as the superior sagittal sinus and where it sits in relation to the different meninges. Okay, another 3D model that I find really wonderful within the brain section is the ventricles. Now, excuse me while I quickly jump between the layers. I want to start at the beginning. But here we have a wonderful outline of the ventricles of the brain, and we can see the choroid plexus sitting within the lateral ventricle. I should have mentioned at the beginning that these models may move a little bit jittery on your side just because I'm sharing my screen over the internet. But if you haven't used these models before and you then go and use them yourself, you will see that everything moves nice and smoothly and seamlessly for the end user. So again, I can move between different layers of the anatomy. And slowly, as I move between the different layers, it's going to give me a better understanding of the different ventricles and their relation to the surrounding neuroanatomy. Okay, at this point, you may be thinking, okay, Stephanie, so far you've shown me a couple of interesting 3D models, but how does this relate to teaching strategies? All of this content that we're going to be taking a look at today can be downloaded and embedded, which means number one, you can insert it into your offline teaching material. So you can insert it into PowerPoints, Word documents, PDFs. And number two, if you embed it, it means you can insert it into your online teaching material. So you can embed this content into your module pages on your learning management system to allow your students to use it online and in an interactive manner. I do highly recommend embedding content into your learning management system because it's going to further encourage your students to interact with anatomy in a three-dimensional manner. Okay, I do have one other tip or trick of how this content can be incorporated into teaching strategies, but I'll get to that later on when we're moving through the menu bar. Okay, but I hope that gives you a good understanding of how you can use these 3D models. Now let's move to the next icon in our menu, which is the imaging section. The first section over here is MRI imaging of the head, and it's broken down into axial, sagittal, and coronal models. So I'm going to choose the sagittal model, and I'm quickly just going to rotate my 3D model so that my 3D model and my MRI image are mirroring each other. Now, using the arrows at the bottom of the screen, if I start to move between the different layers of anatomy, you'll see that my 3D model and my MRI image are moving at the same time to really help me interpret what's happening on this MRI image. And you'll see that when you highlight something on either the MRI or on the 3D model, it's going to highlight it on both to help the students interpret this MRI imaging. You'll see that I still have my information pane. This time it's at the top of the screen, which will give the explanatory information about that structure. So we spoke about embedding the content and downloading the content, and I will still show you how to do that when we get to it in the menu. But another thing to consider is that you can use this as a live lecturing tool. So just like I'm sharing my screen with you today, or I could be projecting my screen in a lecture hall, you can use this online content in your teaching strategies. So if I was wanting to explore the sagittal anatomy of the head and neck, I could open this up and explore it with my students while I lecture them on it. Okay, after the head section, we have sections of the brain. Now, when I open this up, please note I'm not going to get an MRI image, but that's okay because these brain sections are still incredibly helpful in teaching because often when we go through the neuroanatomy of the brain, especially if we're using cadaveric specimens, we often use those axial slices through the brain to take a look at the anatomy at different levels. And here we have a digital replica of that experience. So again, if I use the arrows to move, oh, excuse me, I accidentally opened my settings. If I use the arrows to move between different layers of anatomy, I can visualize the anatomy at those different levels, and I can identify the structures and still read about the important information relating to those structures. All right, going to the next icon in our menu. Here we have a range of two-dimensional slides or images. I'm not going to take you through all of them. We have some anatomy illustrations as well as some clinical slides, which give images of some common clinical conditions that may affect the head and neck. But what I do want to put more focus on are the dissection slides and the head MRI slides. So cadaveric anatomy is incredibly important to give the students a realistic view of the patient with a cadaver anatomy. And here we have some really great interactive dissection slides. One of the ones that I'd like to show you is this dissection over here, where once again, we can visualize some of the different meningeal layers, as well as the cranium over here, the pericranium, and the epicranius, followed by the skin. If we move below the bony layers, we can see the dura mater over here with some arachnoid granulations, as well as some of the meningeal arteries, and we can see the arachnoid mater, and then the cerebral hemisphere. So again, these dissection images, you can insert them into your lecture content to always help the students refer back to a realistic view of what the anatomy looks like. Then there are a range of movies and animations over here, but I'm not going to focus on those today. Please do go and explore them at your own time, but these are going to cover the biomechanics of the head and neck. But because I'm focusing on neuroanatomy over here, I'm going to move past those and go to the rest of the menu for time's sake. Okay, so this is simply another collection of 3D models, but here they have been arranged in more of a focused approach. So if I go to let's go to the nerves as an example. You'll see we have the different plexes, and if we open up or maximize these lists, we can select 3D models that will show or focus on individual nerves. There I have my dorsal scapular nerve. And again, these 3D models are going to work in the same way as the 3D models that we took a look at in the beginning. Okay, after these anatomical structures, there's an alphabetical index, just like a traditional textbook would have. You can favorite any content, and you'll see it's asking me to log into my personal profile. If you have one, it's great to stay logged in. If you don't, something you should be aware of is if I favorite this 3D model right now, this favorite is going to be stored to the browser, or in other words, this device. So if I then go onto my phone and go onto Primal Pictures or anatomy.tv, I won't be able to view my favorites. But if you are logged into your personal profile, all of your favorited content is going to be stored to the cloud, which means no matter what device you use Primal Pictures on, you can access your favorites as long as you're logged into your personal profile. Using these favorites is another great way to curate lecture content. So here I could favorite or save specific 3D models, slides, or dissection images that I would like to open up during my lecture to help my teaching. And instead of finding those 3D models or images each time, you'll have them saved here, and you can simply toggle between your different favorites. Then you can also share a link to anything you are viewing or are looking at. And something that I would strongly recommend is including links to content throughout your lecture slides. And this is going to prompt students to go and explore the content on a deeper level outside of their contact teaching time with you. These links are also great to insert into your learning management system if you're not wanting to embed the content for any reason. Okay, speaking of embedding, here is that embed function. So for argument's sake, let's say we are going to embed this 3D model over here into our learning management system. I'll come and click embed. If I would like to include the information pane, then you'll say embed text. And if you would like a link to Primal Pictures so the students can be prompted to go to the platform, you can also include the product link. And then you can play around with window size and see what works best on the layout of your module page, after which you will select your learner management style. So I'm just going to choose a generic iframe tag, and here my code has been generated, which I can now copy and then paste into the embed function on my LMS. Okay, then very, very importantly is the download function. You can download anything you are viewing on Primal Pictures by using the download function, and that includes an image of a 3D model, any movies, any slides, as well as the text. So here I have an option either to save an image of the 3D model or to save the text that is currently sitting in my information pane. And if I change the text by selecting a different structure, when I click Save Text, it will always save the text that is currently displayed in the information pane. Okay, and then lastly, there are some settings that you can change according to your personal preferences. But that brings us to the end of this title, which is covering the head and neck anatomy with some focus on basic neuroanatomy. My take-home points from this title over here is firstly, if we're focusing on neuroanatomy, there are some really wonderful 3D models of the brain over here, which will help the students have a better spatial awareness of how the structures within the brain are all laid out and how they relate to each other. Another important feature for me are the sections through the brains, especially the axial sections, and then very importantly, the dissection slides. Okay, but now let's jump into our next title. So I'm going to close this off, and now I'm back at the homepage of Primal Pictures, and our next one within the clinical specialties is otolaryngology. This title will be laid out very, very similarly to the previous title, but the content is going to differ. So again, we have the menu on the left-hand side, our main viewing pane in the middle, and our information pane on the right-hand side. The first icon, once again, are different 3D views or 3D models. And these 3D models work the exact same way as the previous ones, but the types of models that you find here compared to the previous one are going to differ a bit. While we're in otolaryngology, this, as I'm sure you all know, is commonly referred to as ENT, or ears, nose, and throat, and I'm going to be focusing on some of the ear and throat anatomy. And I'm going to come down to the throat and select a 3D model of the larynx. I've already showed you how these models work, so I'm not going to focus too much on the functionality, but I would like to speak about a bit of a personal story here. So I've always viewed mastering a skill as see one, do one, teach one, and then you're good to go, right? Well, when it came to the anatomy of the larynx, I struggled, and I'm going to be very frank here. So I saw one when I was an undergraduate student, and I had my lecture on the anatomy of the larynx. And then I did one when I dissected a larynx, but unfortunately my dissection skills weren't great. And I'm sure you can all appreciate that after rigor mortis and preservation of the cadaver, they unfortunately all sit like this, and it's really tricky to dissect the throat region. And then I taught one when I became a lecturer, and I was lecturing speech, hearing, and language pathology students on the anatomy of the larynx. But I couldn't say with true certainty that I properly understood the 3D anatomy of the larynx and how all of these very fine, intricate structures relate to each other until I got to interact with a 3D model on Primal Pictures and take a look at the larynx from a view like this. And once I had the opportunity to do that, for the first time with true certainty, I could say that I understood the three-dimensional anatomy of the larynx. So this example over here taught me the true power of Primal Pictures and using these 3D models in anatomy education. Okay, so that takes us through the 3D views. Once again, you will have MRI imaging of the head and neck. This does work the same as the previous one, so I won't go into those. There again are a range of slides. This time we have some different slides from the previous one. There are some anatomical illustrations. I'm not going to go into those. There are also some developmental illustrations to help with understanding some of the embryology. I'll show you one of those as a very brief example. But you probably won't be surprised that I do want to put some focus on the dissection slides because, again, I do just feel like they are very, very important. Here we have a dissection of the posterior surface of the larynx, and the constrictors and the muscles around the larynx are, again, really tricky to understand and tricky to teach as well. So here we have a wonderful interactive dissection that's going to help us understand the musculature that surrounds the larynx. And then after the dissection slides, there are again some clinical slides. Here we start leaning more so into the surgical anatomy, which is very exciting. And I'm going to take a look at some of the clinical slides that relate to a cochlear implant. Here, for example, we have a cadaveric dissection showing a posterior tympanotomy. Forgive me, I struggle with that word a little bit. So we have a few different dissections over here. We also have a diagram that shows how a cochlear implant works and where the different structures sit. And we have another dissection over here of the mastoid process. Okay, and then after those clinical slides, which is where we can start exploring the surgical anatomy, there are again still MRI slides, and these are nice and interactive and really helpful to work on interpreting MRIs. Okay, then after the slides, there are some movies. This time, we don't just have biomechanics, we have some clinical video content. So these are categorized into patient examination and surgical procedures. If I go into the patient examination side, you'll see we have 3 different examples over here. I'm going to stick with the ears and the throat. Sorry, nose, we're ignoring you today. But I'm going to mute this just because I'm showing you the content and we're not actually learning about a physical examination of an ear today. But I'll briefly just tab through this video, and it does have a voiceover where it will take you through external examination of the ear, and then it will also go through inserting an otoscope into the ear and taking a look. Let's just go a bit quicker, taking a look at the tympanic membrane, and it will go through identifying the important features of the tympanic membrane and some of the ossicles sitting in the middle ear. Okay, I think this stroboscopy video is also very interesting and gives us a lovely view to again help the students think in a clinical manner. I'm going to come quite far ahead in the video, but here you can see that we can visualize the mucosal wave and take a look at how sound is being produced. So this again is muted, but the patient is being asked to make specific sounds, and then we can see how the larynx is changing and how the vocal folds and cords are changing to produce the sound. After the patient examination videos, we have surgical procedure videos. And I'm going to come to the cochlear implant example. Let's just give it a bit of a moment to load, and I am going to mute it again, but please note this all has a voiceover explaining what is happening. And if we play the video, it is going to go through the surgical procedure for a cochlear implant, all the way from the beginning to the end. So I'm going to buzz through this very, very quickly, but here we have a lovely surgical example, which is going to show all of the steps involved in a cochlear implant. Okay, so understanding the anatomy is one thing, but translating it to the clinical setting is a whole other ballpark, and this content over here is going to be really, really helpful for that. Okay, then we do have biomechanics videos and surface anatomy videos and animations, but I'm not going to focus on those. Okay, after those sections of the menu, we have some clinical text. We have 3 different categories over here. We have development, and this is going to go over some of the embryology. We have patient examination. So let's choose the ear as our example. And if you open that, it's going to give you a written explanation of how to do an examination of the external ear. Currently over here, what's busy loading is that video that will take you through examination of the external ear. After the patient examination text, we have text that will relate to surgical procedures. So I'm going to go to otology and go down to cochlear implants. And let's choose the surgical anatomy as our example. Again, what's loading over here, it does just take some time, is that video that will take you through the surgical procedure of a cochlear implant. But instead of just listening or watching it, here we can read about the process. And what this is doing is helping cater to different learning styles. And you will see that some of the structures or text are in orange. And if you select the orange structures, it's going to open up a visual that's going to help you understand what's being explained over here. So again, please bear in mind that all of this content can be downloaded for offline use, which means you can insert it into your teaching content. You could embed all of this. You can grab a link to all of this, and you can, there was one other thing I was going to say there, but my words have lost me. We can embed it, we can save it, we can download it, and you can copy a link to pop into any lecture notes or anything like that. Again, please remember that this can also be a live lecture tool, just like I'm using it to give you some training today on how to use the platform. Okay, but I'm going to close that up. And that kind of brings us to the end of the clinical text. I hope that gives you a good view of the kind of text you can expect to find there. All right, then the rest of the icons in the menu should actually look quite familiar, and we're going to whiz through them because we already saw them in the previous title. So again, we have a collection of 3D models. This time, the 3D models are collected with more of a focused approach, but all of these 3D models will work the same way as the 3D models that we've already taken a look at. You have the alphabetical index. You can favorite any content, which is really helpful for curating content that you want to take a look at during a lecture with your students. You can share a link to anything or copy a link. You can embed it into your LMS. Very importantly, you can download it to pop it into your teaching material. And again, a few settings you can change according to your personal preferences. Okay, but that brings us to the end of otolaryngology. For me, the standout points within this title, starting with the basics of the 3D models, I really think that this 3D model of the larynx is very, very helpful for understanding the anatomy of this region. When it came to the slides, a great point for me over here were the clinical slides that relate to various surgical procedures. Very importantly, were the clinical videos or movies. And my favorites and the most important ones to me are the surgical procedure videos. And then the clinical text was really great for helping cater to different learning styles. If someone hears better, if someone learns better by hearing, the movies are going to be great for them. But if someone learns better by reading, then the clinical text is going to be really great for them. Okay, but that does bring us to the end now of otolaryngology. So lastly, we are going to jump into the disease and conditions title. Now, this gives really great concrete examples for students to try and apply their knowledge into the clinical setting. So within this title, we will have just under 100 common diseases and conditions from 16 different clinical specialties. And for each of these diseases, it will explore the anatomy that is affected with that specific disease. And it's going to cover the symptoms, diagnosis, and treatment. So I'll take you through 2 different diseases for this example. But let's firstly just orientate ourselves things should look somewhat familiar. This works very similarly to the previous titles, but looks a little bit different. So you still have your menu on the left-hand side, your main viewing pane in the middle, and your information pane on the right-hand side. For our first disease that we're going to take a look at, I'm going to come to the first icon in the menu, which are the different clinical specialties, and I'm going to scroll down here to neurology. Once I click my clinical specialty, you'll see that this information pane has changed. So let's now minimize that and focus our attention in the information pane. For the neurology specialty, I have a list of diseases over here, and you can toggle between the different diseases to get the relevant information for them. But I do want to use the first example, which is Alzheimer's disease, as the first one that we will go through. You can then minimize this list of diseases to focus your attention on the disease that you have chosen. For most of the diseases, the first thing you'll be presented with is a movie or a video, which is actually going to cover everything that's going to be covered in the information pane. So again, here we're catering to different learning styles. I'm going to mute this video, but if we play it, it will be a narrated video. We're not hearing it right now. That will go through what this disease is, how it progresses, and the anatomy that's affected. And it will also go over the causes, the symptoms, and the treatment, while giving us some really great visuals of the gross anatomy and the microanatomy that's relevant to this disease. Okay, but all of the same information is also covered in the information pane. So we have an introduction into what Alzheimer's disease is. After that, it's going to review the normal anatomy that is relevant to know, because this is the anatomy that is being affected by this disease. So we cover the basics of the anatomy of the brain. We have the different hemispheres of the brain. And as any image comes up there in the information pane, if I click on it, it's pushed over into the main viewing pane. Okay, we also have a lovely visualization of the microanatomy. And then we move down to what is Alzheimer's disease. So it explains what the disease is and that it is caused by the excessive buildup of two types of proteins. And we can take a look at those proteins. Here we have the beta amyloid plaques and the neurofibrillary tangles. It will then explain those important proteins to us and then go through the stages of Alzheimer's disease or explain how this disease progresses. We will finish off with the anatomical consequences of the disease, which in this case are brain inflammation, reduced gray matter, and ventriculomegaly. Then after it explains those in more detail, we get the treatment for Alzheimer's disease, and we finish off with PDFs that are going to cover the causes, symptoms, and treatment for the disease. These PDFs are actually geared towards patient education. So they're really easy to understand. Plain English has been used. And this is really great for the students when they're first introduced to the disease, because this English is very easy and clear to understand, but it can also be used directly in the clinical setting for patient education. Okay, but if we were finished with this disease and finished with neurology as a specialty, we could go back to the menu and choose something else. So I'm going to go to otolaryngology because we have also focused on ENT or otolaryngology throughout this training. And I'm going to come down to tonsillitis, a very common disease, whether we like it or not. And here, again, it's going to give you a movie that will cover the important information relating to tonsillitis. And all of that information will also be covered in the information pane. So we're introduced into what the tonsils are. We can go over or revise the normal anatomy. It will tell us what tonsillitis is. We have the anatomical consequences of tonsillitis, and here we can see the pus-filled white spots sitting on the within the palatine tonsils. And again, we have those PDFs that will go over the causes, symptoms, and treatment of tonsillitis. Okay, and then just to quickly go through the rest of the menu, all of this should look familiar to you. There's the alphabetical index. You can favorite any content. Again, really great for curating information if you want to use this as a live lecture tool. You can share a link to anything. You can embed anything, and you can download anything. Okay, so for me, I don't have specific take-home features or points here, but I do just believe that it's very important to translate your theoretical knowledge into the clinical setting. And I think it's really great to go over diseases that may affect the anatomy that you've covered within that class or within that lecture series to help your students think critically and apply that knowledge into the clinical setting. Okay, and that officially brings us to the end of this training session. So it's really wonderful that you've been here today, but you may want some short training videos, or you may want to review some training once again. And we do have a YouTube channel where we post training videos online, which are going to be really helpful for you, but also very helpful for students. I would actually recommend embedding some of our shorter title-specific training videos in your learning management system to help your students know how to use Primal Pictures and empower them to guide their own learning outside of the classroom.